Hello, my name is Ola Shabodu, and I am presenting my capstone project, which is a narrative review of obesity prevention programs for low-income adults in New Brunswick, Canada. So my presentation is going to start with an overview of obesity in New Brunswick and Canada, and then I'll discuss basically what the rationale for my study is, and then I'll talk about the methods that I used and some of my findings and proceed to a conclusion. Now, obesity in Canada. So there's been an increasing rate of obesity in Canada. Between 2003 and 2012, the obesity rate in Canada increased by about 17.5%. And of course, we know obesity basically is a significant public health issue, not just in Canada really, but very much so in the world. Obesity has been linked with a lot of chronic illnesses, so like type 2 diabetes, cancer, certain types of cancer, cardiovascular diseases, and so on. It has been found basically that about 1 in 4 Canadians, so that's 6.3 million people, were obese in between 2011 and 2012. Now, New Brunswick is a province in Canada. It's one of the smaller provinces on the eastern part, on the Atlantic, in Atlantic Canada, but it has one of the highest rates of obesity in the country. In 2017, the Statistics Canada basically estimated that about 70% of the adults in New Brunswick were overweight or obese. And furthermore, there was, by New Brunswick Department of Health, it was found that the 3 regions in the province that had the lowest income reported to have the highest levels of overweight and obesity. And it has been found, in the literature, many studies have shown the correlation between social economic status and obesity rates, and really that typically people that have low social economic status tend to have worse health outcomes. Given this is important for public health interventions to address obesity and to establish obesity prevention that's targeted towards low-income communities in order to remove or to solve the issue of the health disparities. However, in New Brunswick currently, the obesity prevention strategies are limited and programs are limited, and the ones that are established are really marketed for the entire population with little attention directed to their suitability for the low-income households. So because of this, my study basically aims to conduct a review of the literature to see what interventions have been designed for obesity prevention in low-income adults, and basically to analyze their effectiveness and select interventions that could be effective for implementation in New Brunswick. My narrative review followed the 5-step process. First was to identify my research question or objective, which I've just stated. Then I went on to look into search methods for identifying relevant studies. So I conducted searches on the main databases such as PubMed, Medline, PsycInfo, and Google Scholar using various keywords like obesity, low income, program, prevention, intervention, words like that. And then I went on to basically select the relevant studies using my exclusion and inclusion criteria. The study selection I'll go over a little bit more in the coming slide. And then after selecting the study, I basically used a spreadsheet template to extract the relevant information from all the eligible articles. Basically, the information that I looked at was the type of study, the study design, the program in question, the description of the program, that's the nature of the intervention, and basically what the evidence is supporting is its effectiveness, so the outcome or the findings of the study. Now, this is a quick overview of my study selection process. I started out with the initial search, came out with about 584 results, narrowed that down by reviewing the titles and checking for the ones that met my inclusion criteria. That brought that down to about 104. And then with removing the ones that met the exclusion criteria, I had about 32 papers. And out of those papers, I removed the duplicate studies, and the ones that didn't meet the inclusion criteria, that left about 14 interventions. Now, of those 14, 8 of them had poor evidence or inconclusive evidence, or just the studies showed that the intervention wasn't effective. And so it's about 6 interventions that I'm going to discuss in my project and in the paper. The 6 interventions are the ones that were targeted for low-income individuals. They were tested out on low-income individuals, and they were found to be effective, both like in weight loss, in improving dietary behavior, improving physical activity, and things like that. Now, these 2 slides show the six programs that I discussed in my paper. Just a quick overview. I had the programs really varied in different ways. So, for example, the Wise Woman program, the Illinois Wise Woman program, was a 12-week lifestyle intervention. So it took more of a lifestyle approach. It consisted of weekly group discussions of basically cognitive and behavioral processes for behavior change, and they were tested out on low-income women with a fairly large sample, actually. The Weight Wise program was also a weekly group education type of program as well, and it was also tested out on low-income, overweight, or obese women. The Caranjo exercise is unique in that it focused basically on just exercise. So the intervention group had to go through 3 15-minute exercise sessions for 6 months, so weekly for 6 months. And they were found to be very effective, actually, because after 6 months, there was quite a significant difference in their weight and BMI compared to the control group and pre and post the intervention. We also had there's also the Vivamos Activos project, which was a study that evaluated 2 interventions. It basically looked at, the first intervention was a case management clinical-based lifestyle counseling, so a counseling intervention. And the other one was the same counseling intervention, but coupled with home visits by community health workers. So this study was good in showing the effectiveness or the impact of having home visits in addition to a counseling intervention. The results showed that after 6 months, so after the program, there was a higher mean weight loss in the group that also had the home visits compared to the ones that didn't, and the control. So the home visits basically improved or enhanced weight loss after the intervention. But then during a 12-month and 24-month follow-up, there was no statistical difference anymore between the weight loss in the group. So weight loss maintenance was an issue with that study there. There was also a study for workplace weight loss intervention. This was focused in the workplace. It was an intervention that targeted both diet, exercise, and cognitive behavioral training. And it basically took place in the workplace. And it showed that workplace interventions can be very effective, because they did show a significant difference in the weight as well. There was a significant weight reduction pre and post the intervention. And then finally, there was the SHAPE program, which is also unique. It took an e-health approach. So there wasn't actually physical contact, but the participants would receive phone calls and would engage in self-monitoring activities using interactive voice response phone calls. And that was actually quite effective, because the intervention group did show a weight change that was larger at 12 months compared to the control as well. So these studies I discussed further in my paper, and I also discussed some of the limitations. The limitations of the study The limitations of the study was that was basically in terms of the generalizability. So a lot of the studies didn't have, the participants that were used in a lot of the studies were not representative of the population that would be in New Brunswick. For example, 5 out of the 6 studies only tested out the intervention on low-income women, low-income, overweight, or obese women. However, in New Brunswick, for example, the low-income, overweight, or obese population is made up of about 69% females. So males also make up a large percentage of the low-income, overweight, or obese population here. So it'll be important to have future studies that look into the effectiveness of these interventions or other obesity interventions, obesity prevention interventions in using basically a sample of participants that are representative of the population in places like New Brunswick or other cities in North America. Another issue was economic evaluation. That's another recommendation I would say for future studies would be to consider economic evaluations in order to see which of these studies that have been proven to be effective, which of them are the most cost effective, because resources are always limited. So it'll be important to establish the financial sustainability of some of these studies. Thank you.